was part of the Itty Bitty Titty Committee before, and I got implants when I was
president.
21. There you go. I'll be vice.
I'm your host, Ariana, and this is Hot Girls Have.
Hello, and welcome back to Hot Girls Have. We hear a lot about breast implants, but today we're talking about breast reductions. Have you ever wondered what you should know before getting a breast reduction? Are there any pros? Are there any cons? Did you know that breast reductions can actually impact your mental health? Today, I'm talking to Dr. Killeen, one of the top double board certified plastic surgeons in Beverly Hills. We'll explore cutting-edge advancements, risks and emerging trends, and we'll address some societal norms and body positivity. Dr. Killeen, welcome.
Thanks for having me.
We are so excited to have you. Okay, let's jump in. Let's start with the basics. What exactly does a breast reduction surgery consist of, and why might someone consider it?
Okay, so that is an awesome question. So breast reduction is a surgery that makes your breast smaller. Mm-hmm. And so any woman that wants a breast reduction can have one. We just have to figure out how to do it, and there's different techniques. So basically all of the different techniques do the same thing for the most part. They make incisions in a strategic pattern, which allows me to remove tissue and then put you back together in a smaller, perkier, higher, more youthful looking breast. Mm-hmm. There is one technique that doesn't have a lot of incisions, and that's just plain old boring liposuction. So some women are candidates for just doing liposuction of the breast, and they can have their breast size go down a half a cup size to sometimes a cup size at the most. Mm-hmm. So it just depends on what you as an individual need or want.
Okay, and you figured that out, I'm guessing, just in a consultation.
Yeah, in a consultation. So, I mean, you can kind of guess just looking at yourself. If your breast shape is close to what you want, you just want it a little bit smaller.
Right.
Liposuction may be great for you. If your breasts are very large, very droopy, and you just want everything back up higher on your chest, a lot smaller, then a breast reduction, a traditional breast reduction is the way to go. Mm-hmm. And the most common incisions are going to be a lollipop incision or an anchor incision. So in my practice, most women get a lollipop incision, but
I love that name.
I know, they're cute. Technically vertical pattern
so
and
cute.
Wise pattern, but lollipop and anchor is better. I like that incision pattern, but every surgeon has their preference. And so you always want to go with what your doctor recommends.
Mm-hmm. Love it. So tell me about the general ages that people are kind of considering this, and what is kind of the youngest, what is kind of the oldest?
So it used to be a surgery we would tell women, wait till after you have kids.
Right.
The problem with that is that really makes women wait for a decade or more with large breasts that are causing them pain and symptoms. And we've walked back on that in recent years because women are more than just their baby making and baby feeding parts, right? Like your mental health and how you feel about your body and
Amen, girl.
Your physical health.
Amen, girl.
Right?
Yes.
It's more important. So the youngest you want to do, basically you want to wait till your breasts are done developing. You don't want to start, have a breast reduction too early and then have your breasts grow again if at all possible. So typically if you're 2 years out from your period, your first period, or your breast size has been stable for at least a year, that's usually a good place to start. So I've done breast reductions rarely on girls in their 15, 16-year-old range. Okay. That's usually girls that have a developmental issue where their breasts grow very, 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 very large. I would say for the average patient, probably the youngest you want to consider this is 18 or 19 years old.
And now walk me through some of the health benefits of this. I know you just mentioned, some of those physical health benefits. I know there's also some mental ones.
Absolutely. So, there's a few things. First of all, girls with very large, disproportionate breasts are often very self-conscious. They don't feel good in their own bodies. They dress a certain way and they hide them. And so having breasts that fit your body and fit who you feel you are as a person is very empowering. I will see patients come in and I'll meet them and everything's baggy and they're leaning over like this, hiding. And then they'll come back in and they'll be wearing, an adorable on-trend outfit and they just feel like a different person. And I often have the moms involved because a big part of my population of breast reduction patients is young women and they often bring their moms. And
I love that.
I love it too because I think moms are the best caregivers, so much better than boyfriends and husbands. Moms are the best. But I had this mom and she brought her daughter in at age 19 and at her 6-month appointment, she's like, I want to show you something. So her daughter had this group of friends from high school and they would travel together every summer. And the summer before her breast reduction, the 4 girls were in the water and all of the girls were like this in their bikinis and her daughter was like this. And then she showed me the summer after the breast reduction and her daughter was posing like all the girls.
I love that.
Me too.
Yes.
And it like brought tears to my eyes because like right there, that's why you do it young. So you can feel good in your skin and feel like you're part of the crowd and you're not hiding something.
So tell me about some kind of I know you mentioned liposuction, but maybe some non-surgical alternatives or just complementary treatments to this?
Sure. So, whenever you're looking at an area of the body that you're trying to do something to from a plastic surgery standpoint, we call it an aesthetic unit. So, that unit, that part of the body, there's different parts to it. It's not just the breast.
Right.
There's little fat pads that surround the breast. So, there's the axillary fat pad. That's that little guy that likes to stick out over your bra.
Mm-hmm.
And then there's something called the bra roll, which is a fat pad on the side. So, women often have areas in addition to the breast that they want to adjust to get the best possible result. I would say most of my patients don't do anything, but there are some patients that are really bugged by those areas. And it's so easy to address them at the same time while you're asleep in the operating room.
Okay, gotcha. Is there something where like maybe if somebody's considering this, they should first look at maybe something else? Or are you like, yes, let's just jump right in?
There's just
Kinda
really
depends.
no substitution, unfortunately, for breast reduction. It's a surgery. People will say weight loss, but that's not really going to help you because every woman's breasts are their own proprietary blend of breast tissue and fatty tissue. And so when you lose weight, your fatty tissue gets smaller, but the breast tissue does not.
Right.
And so sometimes it even augments the disproportion when you lose weight. So if you're at a nice, healthy weight that you're comfortable at, I would never recommend losing weight to try to make your breasts be smaller. It's not going to work, and it's just not going to solve the problem.
And it's probably not very healthy for you, too.
No,
if
it's
you're
not
at
healthy for you.
A healthy weight. Makes sense. Okay, give us a quick timeline of the recovery process post-surgery.
So the recovery for this surgery, believe it or not, is pretty easy for the average patient. And I always get attacked when I say this on social media, but I do tons of breast reductions, and this has been my experience that women do amazing after this surgery. And it's very rare that they have a difficult recovery, which is awesome.
Yeah, that's amazing.
It's amazing. So I use a long-acting nerve blocker in the operating room, and that takes a chunk of the pain away for 3 to 4 days. So most of my patients just take over-the-counter medicines. I give all of my patients prescription medicines, but almost none of them take them. So that just goes to show you those nerve blockers work pretty well.
Wait, why are you getting attacked on social media?
I think the chronic pain community and the OB community have had a history of not addressing women's pain. And so I think when women hear a doctor say, you may not need this, it touches a nerve.
Yeah.
There's like a raw spot. And even though it's a different issue, sometimes it gets misinterpreted as being the same issue.
It's social media,
It's
There's trolls out there.
Yeah, and I think
fair.
People often can't listen to information without the context of what they've experienced. And so if you've had an IUD placed without sedation and the doctor told you it wouldn't hurt and it did, when a doctor says this won't be horrible, they don't believe you. And so I totally understand that. All I can do is take good care of patients, and I never deprive people of medicines, but usually people don't require the prescription things. And if they do, just for a couple days here or there. Most common complication from this surgery is wound healing problems. So I use a special healing device called a Prevena-Vac, and it's this dressing you put on at the time, like at the end, and it stays on for a week. So I'd say the most annoying part in recovery is that first week because you have this stuff on you, this contraption. But at your 1 week appointment, I take everything off, and that's the point when most of my patients go back to work, are driving, you can be up and around, they feel pretty good. You want to be careful for a few weeks. I won't let my patients do exercise.
It's an open wound. It makes sense.
Yeah, you just want to give it a few weeks to heal a bit better. So by 1 month, I release patients to exercise. They can do anything they want. Just I ask them to start slowly and don't get too excited.
Right.
Most of my patients are actually really excited to go back to exercise because, as you can imagine, having really large breasts limits what you can do from an exercise standpoint. So all of a sudden, patients that couldn't run are like runners. They're trying all kinds of new fun things that they just really couldn't do effectively before. So it's very exciting to see.
Funny, I can't relate at all, me over here, but I can
Same.
only imagine. Absolutely. Okay, now I want to get into some things you should maybe know before getting a breast reduction.
So one of the most common things that people ask about, and I always tell them about, especially when you're young, is that you may not be able to breastfeed. And I think that's a very important thing to consider. So the way that you make milk and you breastfeed is that you have basically 2 types of tissue in your breast tissue that we're milk making. You have the lobules that make the milk and the ducts that drain the milk. And this is all connected to the nipple. And so the way that we do the surgery is we take away breast tissue and we leave a chunk of breast tissue attached to the nipple, and that's called the pedicle. So you'll still make breast milk, and that will drain through the nipple, but the rest of it's removed. And so some women can't breastfeed, some women can. It's very difficult to study breastfeeding ability and what is making you not be able to do it.
Okay.
So the best
so it's
studies,
just kind of a chance. That's
it's
kind of
just
all
a
that you
chance.
can say.
Yeah, the best studies we have show that women have trouble when they've
Okay.
had a breast reduction. So I always tell people, if it's important to you, meet with a lactation consultant early. Have them in your back pocket before you deliver and have a plan to maximize your milk production. I just had one of my adorable patients. She DM'd me and she's about 2 years out from her reduction and she had a baby and breastfed no problem.
Oh.
So you certainly can do it in some circumstances, but you just have to be aware that if you make this decision to do it young, you may not be able to breastfeed. But remember, a fed baby is a healthy baby and a happy baby. And, you know, don't beat yourself up too much. Your mental health is important too.
Tell me about some potential risks with this surgery.
This, for the most part, is a very safe surgery, and we typically do this on young, healthy patients, and so there's not a lot of serious complications. But there's always potential complications, right? So with any surgery that we do, you're going to have a risk of bleeding and infection, and so probably about 5% of patients end up with a bleeding collection. Sometimes it just goes away on its own, and sometimes we go back to the operating room for a quick surgery to remove it. Infection in this surgery is pretty rare. I have never had... for years, I had never had a patient. I just recently had one that was just a normal girl that got an infection a month out. But that, I mean, of the bazillion I've done, that's the only person. Like, this just doesn't really happen.
Interesting. Do you think it's just like the location?
No idea. It just doesn't seem to be an area. I had a patient years ago I cared for that was a diabetic and had a lot of risk factors. So, you know, with her, I, you know, kind of expected. But it's not something we see a whole lot. But, it certainly can happen. Most common complication, like I said, is wound healing problems. So this is a big tissue rearrangement surgery. We're moving things around and separating it from where it gets blood supply or its food. And sometimes it doesn't appreciate that and gives us the finger. And so when that happens, usually everything looks great for 4 to 6 weeks, and then the dissolvable stitches dissolve and things open because you see that it didn't really heal. The stitches were holding it shut, and once they dissolve, you see. And then the wounds, even though they're often small, are a pain in the butt. They can take weeks to get better because since I've disrupted that blood supply, it takes your body a while to kind of figure life out, and then it will heal very quickly. But yeah, that's probably the most common complication. Statistically, I think 20%-ish or so patients typically is what we quote. I see much less than that in my practice, but it's because I use that wound healing device. So I strongly recommend people that are listening to this that are considering a breast reduction that they go and look into this wound healing device because it is an additional cost to you, but I think it's worth it to minimize the chance of this stuff.
Is that something that somebody would need to get on their own, or is that something they would
Your
speak
doctor
to their
should
doctor
get it
with?
for you. Most hospitals have it, but it is an additional charge. And insurance companies aren't covering it right now from what I understand. So I've used it for 9 years or so on every breast reduction, and I've never looked back. Once I started using it, and it makes your scar look nicer.
Oh, we love that.
So some other complications, the nipple complications are often what people are worried about. So there is a chance that your nipple will lose sensation. Some of the older studies show that like a third of women have loss of sensation or decreased sensation. A third have better sensation.
Oh, interesting.
Which is weird. And a third have the same. And the better sensation people are probably, I would guess, just, you know, we don't really know, but probably women whose breasts are really low. When the nerves are not stretched as much anymore, they just go crazy and function better. It's typically not a permanent higher sensation thing. It just it kind of settles with time. In real life, loss of nipple sensation is not very common. Once in a blue moon, someone will say, hey, I think I have less sensation, but it's not something I even would say expect, nowhere near 30% like the older studies. The most common area people don't have sensation, in my experience, is on the side of the breast. If they're going to have any long-term numbness, it tends to be on the side of the breast for whatever reason, and it's just small areas. But I would say that's the most common thing, but still not particularly common. Usually if you just wait a year or so, life figures out a way, and you know the nerves figure out how to function properly again. You can have more catastrophic things like area of fat and breast tissue die. The nipple itself can die. These are less common things, and they usually happen in people that have medical problems that cause blood flow issues. People that have, there's very rare patients that just have abnormal blood supply to their nipple. And so there's no way to know that before surgery. But it's not something that's common. They're always the scary pictures you see online, but it's certainly not a common thing. And then, you know, every surgeon knows how to manage these complications when they happen. So you just want to make sure you pick a good plastic surgeon before going under the knife.
What is something that you should ask your plastic surgeon before maybe deciding to pursue surgery with this plastic surgeon?
So I think the main thing that I always talk with patients about is goal size and where you're going to end up. So probably the biggest reason people are unhappy with breast reductions, and let me just say that's rare because people love their breast reductions. Even people with big complications love their breast reductions. But it's unhappiness with size. So you need to have a real conversation
Communication
with
is
your,
key.
about what your goal is. And so we can't promise cup sizes. And the main reason we ask you that is to get an idea of what your aesthetic is, because there's no 10 commandments of breast aesthetics, right? Or at least there shouldn't be.
Right.
So if you tell me you want to be an A cup, I should make you an A cup. It doesn't matter if I think a C cup is prettier on you, right? What matters is what you want. And so it's always going to be a combination of what you as the patient want as what I as a doctor can do, and it should never be what the doctor thinks is pretty. And so you need to have a real discussion about that. So the limitation on what size I can make you really has to do with the tissue that has to be left behind.
Gotcha.
So in order to keep that nipple alive and happy, there's got to be enough tissue left behind.
Right.
And so if you want to be a little A and you're starting out like, in the stratosphere as like an H cup,
right.
That's probably not going to be possible. And so I think a lot of unhappiness after surgery is remedied by just good communication up front. So you and your doctor are on the same page. You have a good understanding what to expect. I think women that go into surgery expecting exactly a B cup and they don't end up there aren't going to be happy, obviously, because that wasn't the expectation. And my job is to meet your expectation, but also educate you so your expectation is healthy.
Right. Tell me about that after surgery. Somebody maybe asked for something, communication maybe wasn't there. They're left with something that maybe they didn't exactly want. How do you remedy that?
So it really depends on what the problem is. So I think the first thing as a patient, if this is you and you're like, this is not what I wanted, it's too big, it's too small, they're two different sizes, you need to come to your surgeon first. And remember, your surgeons are people too. We're people. And you and I have a relationship together. And so you have to think about it like any relationship. How would you talk to a friend, a family member, a spouse? You want to have a good, healthy relationship. If your boyfriend is late and he walks in the door and you say, who are you sleeping with?
Right.
That's not a healthy relationship. So if you go into your plastic surgeon's office and you say, you did this wrong, what did you do to cause this? You're not going to come to a resolution that makes sense, and you're not going to have a healthy relationship. So I always recommend coming in and saying, hey, this didn't end up how I wanted. I really wanted it to be smaller. Is there anything we can do to remedy this situation? I don't know if there was a miscommunication or maybe there was a limitation because of my anatomy. Is there any way we can make this smaller for me? And then I think you're at a really healthy place. The surgeon is not on the defensive, you're not on the attack, and you both can feel comfortable moving forward. And then
but there's no risk with maybe going back in and taking more out?
There is and there isn't. It depends on exactly what's done. So sometimes patients, it's just a little bit more they want out. And then liposuction is a super easy thing to do. You just pop back. You can even do it awake. You don't even have to be asleep for that. Sometimes if it's a big reduction, often if that's the case, it's something that couldn't be achieved because it was what your goal wasn't possible in the first place.
Right.
You can do breast reductions again in the future, but it's really safest to wait 5 years. So there's been some studies that have shown that complication rates go down significantly after 5 years. Your surgeon can kind of do the surgery in any way they want and have a similar complication rate to the first time. And then you can always put fat back in, of course, if you end up too small. But I always tell people just think about the relationship before you go into that consult, because this person is going to have you under anesthesia. You want to have a healthy, good relationship. I promise you they care about you and they want you happy too. And so, if I came in the room, if I thought you did something, you didn't follow my rules and you had a bad outcome, I wouldn't come in attacking you, because that's not what you do when you have a healthy relationship. You talk it out and figure it out together. And that's the best way to get a resolution with your surgeon.
That makes me think that there have been a lot of instances where maybe the communication wasn't there and you had that angry.
I do.
Who are you sleeping with?
Yeah, I'm an over talker, so I don't have a big problem with patients.
That's good.
Being that angry at me. We all have patients that don't love us. That's the reality. But I do a lot of revision surgery.
Okay.
And so what I've noticed is that a lot of the problems I see with patients that are unhappy after surgery revolve around communication.
Gotcha.
And they just didn't have a good relationship with the doctor. They weren't informed of things that were absolutely expected in their surgery. And I think it causes distrust, and the relationship fell apart. And I hate seeing that.
Yeah.
I like people to feel comfortable with their doctors.
Yeah. I want to transition now to talk about kind of the field as a whole. So are there any innovative techniques or advancements in this surgery that are maybe relevant right now?
Yeah, I think probably the newest thing with breast reductions is going to be use of prosthetic materials to keep the reduction up longer.
Oh,
So,
interesting.
yeah, one of the problems with any type of lifting procedure is there's a bit of a shelf life on it, whether it's a facelift or a breast lift. And breasts are heavy.
Mm-hmm.
And they're only supported really by skin, and then we have gravity and all the everything else we do. And so one of the problems is that things droop with time, no matter what you do, and they droop less if you wear a supportive bra and you protect your investment, you don't bake in the sun, but they droop.
Right.
And so what we've discovered is that there's support material that we can put in the breast that will help kind of create an internal bra, so to speak, to hold the breast up for longer. So these things aren't covered by insurance. So if you are having an insurance covered breast reduction, it would be an additional cost. I don't like permanent things in the breast, if at all possible. I like the ones that dissolve. And there's some on the market that dissolve and leave behind a little thicker scar tissue hammock behind.
Oh, interesting.
And they'll keep the breast up for longer. And I think
Wait, when you say longer, is that like 5 to 10 years, 10 to 20 years?
Yeah, I would say 5 to 10 years is
Okay.
a good expectation for a breast reduction.
Okay, makes sense. How do you see the field as a whole evolving?
Just plastic surgery in general, or in particular with?
I'd say in particular breast reductions.
So I think with breast reductions, we're really in an era of patients being the focus. And so I think in years past, we used to chase after an ideal breast. And there was this weird, bizarre idea that plastic surgeons came up with, that there is an ideal breast. And every woman should be given that ideal breast. And I think we've moved into this new era of breast reductions where women are given what they want.
Right.
And not what we think they should want. And I love that. I love that women come in asking for all different types of things. I love that I have really interesting conversations with people about what their aesthetic is. Do they want a small female breast, a flat chest? Do they want a male appearing chest? Do they want to be proportional? Do they want to be disproportional? I love that I can have these conversations and women really can get exactly what they want out of a procedure, as opposed to be given something that they're told they should want.
How do you think, how did that switch happen? When was that made?
I don't know. I think there's more women in surgery. I think that female doctors have made a big push to listen to women because we're women and we have not traditionally been listened to. I think that this younger generation is just awesome. I don't know how to say. I mean,
we're just kicking butt, taking
they're
names.
just awesome. I know. I'm so proud of these young patients I have. They're all the coolest girls. Like, they're dragging their moms in for a breast reduction consult. They're like, no, I'm doing this. Come on, let's go do it. And they're very empowered. They're very educated. I always joke that all of my young breast reduction patients, like, they should meet. They would totally be friends. They're all like, they're the kind of girl that like hops on a plane and goes to college across the country by herself. Like, they're that type of personality.
Love
and I
it.
just love it. So I think that it's a time when education and information is freely available online. I think women are really encouraged to do things for themselves and to bring themselves joy. And the focus isn't bringing men joy or children joy. It's bringing themselves joy. And I love that. I think it's great.
So actually, on the heels of that, how do you ensure that the decision for surgery is patient-driven and is not influenced by somebody else or society? Because although, yes, it sounds like it's happening more and more, and that's exciting and very empowering, I'm sure there's still the occasional...
Absolutely. There is all the time.
Yeah.
I see patients. I think you just have to be good at figuring people out. You have to be a good people person as a doctor. So the goal isn't to just go in and give the person what they came in for. The goal is to go in and make sure it's the right idea. And I've seen everything under the sun. I've seen women come in for breast reduction and they were concerned that their partner was leaving them and their breast didn't look good and maybe this would fix it. I've had a girl who was sexually assaulted when she was younger and she thought maybe her large breasts were the reason she was a target.
Wow.
And I think sometimes you just have to pick up on subtle things and get to the bottom of why they're actually there. And sometimes the right choice is not to do surgery.
Right. That's fair. Gosh, that's hard.
It's
I can
hard.
only
I know, but I have a
imagine.
psych background, and I feel like
Okay.
my psychology background was some of the most important training I've had in medicine because it helps me understand people better and communicate better. And I think that it's really a skill. I mean, it's worth so
It
much.
sounds
in my
like
life.
it's absolutely invaluable to your
Oh,
practice.
absolutely,
My
for sure.
gosh. You specifically in your practice, how are you promoting body positivity?
So that's a good question. And I struggle with this a lot if you follow my social media. I think plastic surgery is a weird world for me to be in because I'm really heavy on the body positivity movement. I have a daughter. I think I've learned how to talk about my own body in front of her in a way to make her appreciate her body for what it does and not what it looks like. And I try to do the same thing for my patients. And so I think I'm really careful on social media. I don't like to talk about thinness. I don't like to talk about ideal. I don't like to sexualize my patients. I think the goal should just be achieving a patient goal, and that really should be the focus. And my field does a very bad job in this regard, as you know. I think
it's getting there. It's a work in progress. I get
it's
that.
a work in progress, and I think we are a lot of the part of the problem on social media.
Mm-hmm.
And I think that we have an obligation to people, our patients and people in general, to do a better job of encouraging women to love differences in their bodies. I love the idea of doing plastic surgery for yourself. I hate the idea of doing it to conform to beauty standards.
Yeah. How do you think we, and maybe some of the people who are listening to this episode, can help take steps towards that movement?
Be mindful about who you follow.
Wow.
Do not empower people that are not doing good things for you. If you're following a Kardashian, what are you seeing every day? You're seeing people that aren't honest about procedures they've done, that do not promote body positivity. They do things that are potentially dangerous, like tanning. I was just going after Kim last week on my social media about it.
What? She's
laying
tanning?
in a tanning bed. These people.
I've had 2 melanoma skin cancers
I had
removed
one
already.
too. I know. Exactly. It's like, who are you supporting on social media? Because when you follow them and you like them and you give them attention, you're supporting them and you're pushing their message out. And so I think all of us should be more mindful with who we're supporting. Is this influencer I support? What do I like about her? Is this what I want my daughter to be like her?
That's a fabulous question.
Yeah, and I think my daughter's 10, and I think about these things because she's awesome.
Yeah.
And I want her to stay awesome, and she loves herself, and I want her to continue loving herself. And I think I've started unfollowing people. I've started not giving attention to people who don't deserve it. And I think we all need to be more cognizant with who we give our attention to, because I think the bigger chunk of your attention you put on toxic people, it's not good for your mental health. It's not good for your body positivity. And I think we're sending the wrong message to everyone when we're giving these people airtime.
Right. That was so invaluable. That was so good. That was a drop mic moment. Yes. I would love to hear a success story from your practice where a breast reduction just significantly improved a patient's life. I know you've shared a couple so far, but maybe in the physical, mental, all aspects. I don't know, just if somebody's maybe considering a breast reduction and maybe just wants to hear a story.
My God, I have so many. I can't even tell you. I mean,
that's good. That's a great problem to have.
I had a young woman years ago who was in the theater world and was just an incredible star, and had the hardest time because costumes didn't fit her.
Oh.
And it limited what she could do on stage, how she felt about herself, what part she would try out for, and it just eliminated that. It turned her into the star she was. It allowed her to be who she was as a star, because all of a sudden there was no worry. She could try out for the part she wanted. She could wear any costume that was on the rack, and it was just a life-altering thing for her. I had a patient who was quite overweight, had the hardest time exercising because of neck and back pain, felt, like a shadow at school, she told me. She was a shadow. And she came back and she had lost 50 pounds. She was a runner. She looked like a star. She came in with the cutest, most trendy, adorable outfit I've ever seen. And she said it just completely changed her life because how she felt about herself. And it wasn't really, nothing changed. She just all of a sudden saw herself for what she was. She wasn't seeing it before. It was hiding behind those giant breasts that made her self-conscious. And then all of a sudden, she saw herself for who she was, the awesome human she was. And then when she saw it, everyone else saw it.
Right.
Her friend group expanded. She became healthier and started doing physical exercise. That was really fun. She enjoyed it. I mean, it was incredibly special.
That's amazing.
One of my favorites is I had an older woman who had horrible issues with her spine and several spine surgeries. And she was literally disabled, like could not drive, was disabled.
Wow.
And her spine surgeon called me and said, I just don't know what to do with this woman. She's got huge breasts, and I've done every surgery I can. There's nothing else wrong with her neck. I don't know why she's not getting better. So I was like, I don't know about this. Like, I'm not sure breast reduction is the right move, but I decided to do it. And she woke up from surgery and was giggling in that post-op.
What?
And I'm like, are the drugs really good?
What's
Or like,
going
what's going
on?
on? So I came and talked to her, and she's like, I can already feel my hands, the tingling's better. Already feel it. And then her 1-month appointment, she drove to my office, drove herself from San Diego, drove herself.
Gosh.
And she hadn't driven in years because she was disabled. She couldn't feel her hands, was having numbness and tingling. And she said, she was the cutest. She said that her neurosurgeon that did her spine surgery saved her life, but she said, I gave it back to her with a breast reduction. And I'm like, that's the cutest thing I've ever heard. But I mean, it's just every patient comes in at 6 months and is like, I'm so glad I did this. It's the best surgery.
You know, I'll tell you, I was speaking to a couple of people before this conversation, just saying, oh yes, I'm so excited. We're going to be talking all about breast reductions. And they were kind of like, why? And I was like, because it's an important conversation. I mean, this is a very valuable surgery. This changes people's lives. And they were like, does it really? Or does it just make your boobs look a little bit better? Talk to me about that gap in societal thinking.
I hear this a lot from women with smaller breasts or average size breasts. They don't quite understand. And there's a few things about larger breasts that I think are important to remember. Women with disproportionate breasts can't buy clothing off the rack. They can't buy bras off the rack. They don't get to wear certain types of clothing, right? Just purely from that standpoint, that's a nuisance. That sucks. It sucks to shop for dresses with your friends for prom and nothing fits you, right? They can't do the same exercise you can do without wearing 45 sports bras as tight as possible, you know? Your neck and your back hurts. You get divots in your shoulders that can be permanent. At the end of the day, headaches, numbness in your hands. I mean, I think we really downplay how painful very large, low breasts can be. It's really a problem, and it starts young.
Okay, now I want to get a little bit personal.
Okay.
What are some of the top plastic surgery procedures you would do?
So I've done a few. So I'll tell you about the ones I've done, and I'll tell you about the ones I would do. So I have breast implants. Love them. So I'm the opposite end of the spectrum, like we were talking about.
Okay.
So I was part of the Itty Bitty Titty Committee before, and I got implants when I was
president.
21. There you go. I'll be vice. So I had implants when I was 21. So I'm 46 now, so I've had them since then. Love them. Amazing.
No, like, health impacts?
No, not
anything?
at all.
Okay.
I've had 2 revision surgeries. I had saline implants my first set, and then I had silicone implants, and then I switched them out when they should be switched out. As long as you monitor them and take good care of them, implants are certainly not problem-free, but it's important, obviously, to talk about issues with your surgeon before you do it. But awesome, life-changing, 10 out of 10. You have to rip them out of my cold, dead hands. Love my implants. What else have I done? Oh, I had an upper blepharoplasty about a year ago, an eyelid lift. And so I totally get it. I didn't have a lot of extra skin, but I love makeup. And I was noticing that when I would draw my wing on, that I would draw over skin, and it was super annoying. And so I had one of my girlfriends just do a cute little upper blepharoplasty. 1,000 out of 10. Best decision ever. Love it. I can draw my wing any way I want now with my makeup, back to when I was like 20 years old. It's great.
What's the recovery period?
Oh,
there?
so easy. Like, I would say by a week I looked pretty good when the stitches came out. And then I have a whole playlist, if you want to see it, on my TikTok where I did day-to-day pictures. The worst was I did laser on my under eyes. And that was the craziest because of the swelling, but the upper eyes were fine.
So cool.
Yeah, if you want to see day to day, you can see me look like a swollen monster the next day, and then it gets better and better.
Okay.
And I did it under local, no anesthesia. Awesome. Let's see, what else? Oh, I had a little bit of fat grafting with my last breast revision. That was awesome. Love that. And the liposuction of the love handles. There's nothing wrong with that. That's one. It's funny because I would do these like big, huge, like revision surgeries on people, and I would take fat from their love handles, and I'd do like this very complicated surgery, and I'd be very proud of myself, and they'd be raving about the liposuction of the love handles, and I'm like, my God, that's the easiest thing I did at the whole surgery, and now that I've had it,
you get it?
Completely understand.
Oh my gosh. What is that recovery period?
Oh, it's like nothing.
Easy?
Now, I will say liposuction is one of these funny procedures that 90% of people, it's like nothing. And then there's that 10% that think they're going to die. They get like weird nerve pain.
Okay.
So just be forewarned, if you have lipo and you have a lot of pain, it's not you. It's just some people get nerve pain that lasts for a week or two afterwards.
Gotcha. Oh my gosh, so
and
fun.
Obviously, I think tummy tucks and breast reductions are probably the big. If I needed either one of those, I would drop of a hat. Get them. They're both awesome surgeries.
Gotcha. We love ending every episode with one key takeaway that listeners can drop in their group chats. What is yours?
Well, I think that what I always want to tell patients about plastic surgery is that the goal of plastic surgery is not to make you look like someone else. The goal of plastic surgery is not to meet society's beauty standards. The goal of plastic surgery is for you to feel like who you are. And if there's something blocking that, plastic surgery sometimes can help you see it. And so, it's definitely something to consider if you don't feel good about yourself, you feel like a body part doesn't belong on you, you're not who you are with it. Come in and see us, talk about it. We have the technology.
Yeah. Well, Dr. Killeen, thank you so much for being here. This was an amazing conversation.
Thanks for having me. I appreciate it.
Thank you so much for joining us on today's episode of Hot Girls Have. You can find anything we mentioned in our show notes. Want more? Visit our website or check out our social media. This podcast is brought to you by Belly Welly, leading the charge in women's gut health.